Well, I do have 9:15, and our presenter discussion leader today, and by the way, she asked, if I ask questions, will they answer? And I said, yes, they will, right? Anyway, is Eliana Valenzuela. She just now finished her freshman year at ASU. She's a biology major. I know it's more specific than that. She'll correct me and tell you what that is. I'm just glad I can remember biology's part of it. But Eliana, I've known some in this family for a long time. In the early 80s, I met her grandmother, who was a pastor in El Paso, Texas. Some of us know her dad, Jose Valenzuela, who is a pastor in our synod here. And when he was assistant to the bishop, worshiped here a few times with probably a very young Eliana in those days. But Eliana has an interest in particular in healthcare and Latinos, and she's going to talk about the disparity in those kinds of things today. Next week will be our last forum. Then the week after that, we switch to worship at 9 a.m., both online and in person. And next week, I'm going to talk about, okay, we've had over a year of this pandemic stuff in the church. What have we learned? What have we seen? What do we anticipate? What do we think's going on? What do we think will go on? Those sorts of things. So before I turn it over completely to Eliana till 10:15, let's begin with prayer. Gracious God, you are a God of healing who desires all be well. We see in Jesus a constant willingness and ability to heal people, and know that Jesus is showing your same will for us. We ask that we might find ways and methods to make sure that that healing will of yours can be extended to all people. We ask that you help us, give us the courage, give us the strength, give us the insight, and all those things we shall need to confront the inequality we too often have in our healthcare system. These things we pray for in Jesus' name. Amen. Well, Eliana, we belong to you.
Great, thank you so much. My name is Eliana. I did just finish my freshman year at ASU studying biological sciences with a specification in genetic cell and developmental biology. So it is a little long. I am impressed that you did remember the biology part. So I took a class my first semester here at ASU called Latino Health Problems with a very great professor, Dr. Vargas. And it introduced me to a lot of the issues that go on in my community with regards to Hispanic and Latino individuals receiving proper health care with regards to both our non-Hispanic white population and other minorities also. There's a great divide between Hispanics and basically the rest of the US. And I just wanted to start out kind of getting a feel for if there are any questions that you guys have before I get started that you'd like me to touch on, or if there's anything that you know already that I can skip right over. So if anyone has any opening kind of questions or comments, I would love to hear them.
Eliana, this is Terry Putcher. As far as the campus, as far as the ASU, is there issues, and maybe you can address this later in your talk, specifically with students at ASU and healthcare? That might be interesting to touch on too, to see if there is, anything specific to how you obtain your health care, or some of the students that don't have private health insurance, whether they have access to health care on the campus. That might be interesting. Thank you.
Great, thank you so much, Terry. I'll definitely make sure to mention that. Anyone else before I get started? All right, I'm just going to dive right in. Feel free to put anything in the chat or unmute yourself and ask questions at any point, and then I'll leave some time for discussion at the end. But just kind of jumping right in. So Hispanics are the largest minority group in the US, making up over 17% of the US population, and they're also the fastest growing minority group, estimated to reach about over 28% by the year 2060. And so it makes up a pretty good chunk of the US population. And within that, there's a pretty diverse group. It makes up, Southern America, some European continents that speak Spanish, Brazil, Portugal, and it's a pretty diverse community. So there's not a lot of like closeness necessarily between the different nations and people of different nationalities, but the biggest uniting factor, of course, is the Spanish language. Among the Spanish speaking community, about 32% of Hispanic adults speak Spanish only, but 22% speak Spanish and English like reasonably well, and then less than 18% are English speaking only. So we're looking at mainly Spanish speaking individuals within the Hispanic community here in the US. Breaking that down even further, Arizona as a state has one of the highest Hispanic populations for any of the US states. We're looking at over 20% in Arizona alone. And of that, similar numbers, around 30% Spanish speaking only. So one of the biggest barriers then facing Hispanic individuals receiving both quality healthcare and healthcare in general is going to be a language barrier. We see that there are not enough healthcare professionals. So it means doctors, nurses, intake, just simply school nurses, ER, trauma surgeons, just anyone in the industry at all that not only speaks Spanish, but has that medical background, can understand the culture, and can be sensitive to cultural needs, because it's not necessarily enough to know conversational Spanish, like hello, sit here, sign here. There are things that don't translate necessarily from English to Spanish. And so having actually that mentality of the cultural environment is really important. So that's going to be one of the biggest barriers that Hispanic individuals face when seeking out proper healthcare. So we see that can be a huge deterrent, especially with immigrant individuals. They both lack the confidence that they're going to have in like doctors or nurses that will speak their language, and then we see them not even seeking out care to begin with. So among the individuals that we see that do seek out care, a lot of the issues then come down to finding translators, or what we call proxies, which would be a family member, a lot of the times a child, who is acting as a translator. I mean, we can kind of guess why that would cause issues, right? You've got maybe a mom or a dad and a young child, maybe grade school, who does speak English, but think of yourself at 5 or 6. What did you know about diabetes or healthcare issues, heart disease? These are issues that we see very high numbers of in the Hispanic community. We're one of the highest communities with deaths due to cancer, diabetes, and heart conditions. So think of like a young child trying to translate that for their parents. Maybe they don't have the correct medical terminology in mind, a lot of miscommunications, a lot of issues with parents not being necessarily completely upfront with doctors. They don't want to tell their children the sensitive details, or their spouses who are translating. So it runs into these issues where when people aren't comfortable in their medical environment, they're not going to receive the care that they need. If there's not, it's legally obligated that medical practices have to provide translators, but it's not necessarily done. We see that about 16% of cases in which a translator would have been legally obligated are actually provided. And so that's either due to decline of a translator or lack of preparedness on behalf of the medical facility. So that's one of the main issues that we see. Going from that, we reach some cultural barriers. Like I mentioned, having medical practitioners that have an awareness of the cultural sensitivities necessary is a huge thing in the Hispanic community. So, Hispanic community tends to be less trustful of Western medicine, a little bit more religious. And so when they seek out medical care, having a non-Hispanic doctor who maybe took bilingual classes in medical school isn't going to offer the same level of comfort as having a Hispanic doctor who maybe grew up speaking Spanish, grew up in the Hispanic community, knows what it's like to come from there, and then can relate on that personal level. And we see that mainly the issue why that isn't provided is due to education. It's significantly harder for bilingual individuals to receive that higher level of education. There's been a lot of studies done, and one of the biggest organizations that does this is a organization called the Pub. They do a lot of surveys of colleges and the demographic makeup within them. And they found that among graduate communities, so master's degrees, getting your MD, it's harder for people who think in both languages. So maybe grew up being a native Spanish speaker, learned English in school, maybe their brain doesn't necessarily think in English. It's going to take them a little bit longer to complete these courses and read these assignments than it would for someone who grew up speaking only English and is just having an easier time in school. So there's not a lot of support out there for bilingual students. Bilingual education, however, is a group that does have support. So students who are native English speakers trying to learn other languages is a group that many universities do support and do seek out. But already bilingual students learning to just take regular classes and use their natural language skills that way doesn't get as much support. So we see that divide between prioritizing people who already have that inherent skill and are just looking to give back or have the same opportunities as anyone else, versus students who are seeking out this kind of specialized path of, I'm going to be a doctor, but I'm going to serve an underserved community. So it's kind of a double-edged sword, like that doesn't necessarily add up, where you would think that the two groups who are essentially going to be serving the same population would receive the same amount of support. And they don't. And so that's just one of the things that as a nation, it seems not necessarily completely equal. We know life isn't equal. So that is one of the main cultural barriers that we see facing Hispanic healthcare issues. Going off of that, there's a lot of, inherent cultural issues within the community themselves. There's, there's these concepts of, we call them machismo and fascismo, basically masculinity and self-reliance. So within, traditional Hispanic households, there's a large precedent placed on, not really asking for help. If you can just kind of grin and bear it, or if you can do it yourself, that is valued much higher than, needing to seek out care, specifically mental health care. So there's a great stigma against mental health care, both asking for it, receiving it, being treated for it, and just suffering from mental illness in general. A lot of the words actually for mental illnesses like ADHD or autism or depression, there aren't words that translate directly into Spanish. And so what you'll see a lot of the times is, instead of saying autism and just directly translated, the word will be crazy. That's directly translated. So that doesn't help the perception of mental illness in the community. You'll see people just call individuals suffering from mental illness words for like crazy or stupid, because that's the only word they know. Leonard, I see you raised your hand. Did you have something?
Yeah, I have a question for you, since you were talking about the mental health issue. I've got several questions for you, but that's the one right now.
Yeah.
My impression from Spanish and Portuguese people speaking from Brazil it has been a process for many years back, and I'm not sure it's true, but I want to ask this question, that when a family member, a child, or even a mother or father that has gone into a mental health issue, that they tend to hide that person from the rest of the world, in the sense that they sort of deny to anybody that that person even exists anymore. And while it is that they take care of them okay, not necessarily medically, but they take care of them as best they can in home, because we all know most Hispanic people are very family oriented, stay together, and so on. Is this still something that you have heard in any of your classes, that people still hide those that have mental issues?
So that's a wonderful question. Thanks for asking that. I have not heard that that's still what's going on. What I have seen, and I read a study on this, is that parents are denying their children specialized, especially in schools, kind of like what you're saying, like a lack of wanting to address it.
Okay.
They're being told that their children need these classes or should go on these medications, maybe see a therapist. Instead, they're choosing to deny that and maybe focus on prayer versus therapy, or religious education instead of mainstream education, things that prioritize their values and beliefs over things that force kind of Western medication beliefs on them. So not necessarily like a hiding, but more of a just face that doesn't reveal everything that's going on to the public.
I have heard this in the Hispanic community before, in past years and so on. I know for a fact that my best friend is from Brazil originally, and same age. We're both going to be 73 shortly, and so on. And he talked about how families routinely hid children that had mental disabilities, or if they were born with Down syndrome or something like that. They literally hid them in the house, didn't send them outside at all. And in many cases, neighbors didn't even, they may have known that the woman had a child, but then they've never seen the child, and so on. And that was a regular process. Now he comes from actually a upper middle class family from Brazil. It doesn't really exist in reality, but they own their own businesses and they had money. So he was well educated, and so on. So it isn't like there was an educational issue there, but this was something that routinely happened. So I was just curious if it's still a thing.
Yeah, and
You don't have to,
that very well may still be going on in the countries of origin. It sounds like that's kind of where your friend was experiencing those occurrences.
Yes, exactly.
May still be going on there. My focus is on US, and so that's what I ended up seeing in the US, but I would 100% believe you it's still going on in a lot of the countries of origin.
Okay. So it is possible that some of the folks that are coming over here as immigrants, as a family, may have a child like that, and we're not really aware of it until they get settled somewhere, and then they hide them anyway because they came from a culture that still does that. Yeah.
Right. So I think probably the main deterrent for that would be in the US, we have truancy officers and truancy. So
okay.
Children born in the US, they're going to be tracked down. They're going to have.
Well, I meant children coming as a whole family here. So just, where they already have the disability, and then whatever happens from there. So we don't need to continue. I don't want to waste your time. Thanks.
Oh, it's fine. You mentioned other questions. Did you want to bring up any?
No, you haven't covered it yet. I'll wait till later.
All right, thank you.
Wait till later, because you haven't covered everything yet, so.
All right. Yeah, so that was a great question. But yeah, we do see a lot of, decline of care, which it's quite sad, but it really does result in that, traditional value belief that, church would better treat or sort out mental illness than a doctor would. And it kind of ties back to that self-reliance that's inherent in the community. So yeah, thank you so much for bringing that up. going off of that, I kind of wanted to talk a little bit more about the gender bias that exists. So, obviously it's going to be more prevalent within immigrant population than first generation, and then second generation, we see it dwindle due to what we call acculturation, which is basically when you first immigrate, most of your values and beliefs are pretty similar to that of your country of origin. But as time spent in the country, as generations are born in the country, we see them adopt more of the US culture, US mindset, and that's acculturation. Among the immigrant population, though, what we see a lot of is this gender bias, where men in particular are really, really stigmatized for seeking out any sort of mental health care, any sort of just physical health care in general, going in for yearly exams, doing any sort of preventative medication, just simply caring about their own physical well-being in general, not necessarily a super well thought of trait in the Hispanic community. If you have ever met, an immigrant family, typically the man of the household, very hardworking, very stoic, cares about their family, does everything they can for their family, not necessarily a super self-care oriented individual. And that's just typical of the community, but it can lead to a lot of problems down the road where we see these high rates of occurrence of strokes and repeat strokes, diabetes, heart disease, Alzheimer's in the Hispanic community. And a lot of these are preventative occurrences. With proper diet and medication, you can maintain diabetes, you can bring down cholesterol, you can manage heart disease, you can offset the effects of Alzheimer's with early preventative medication or treatment. And those are the things that we're not seeing implemented within the Hispanic community due to this fear or shame of going to a doctor, getting regular checkups, taking medication, exercising on a regular basis. It's not inherent and it's not received well. And, a lot of people would rather look strong than be healthy. And so it's definitely an issue that we see, particularly among male Hispanic individuals. So we see a decline in it as the generations progress. Like a first generation Hispanic male may go to regular checkups versus their immigrant parents, and second generation is, or usually more than 50% accultured. Third generation may not even speak Spanish. So it's that sort of thing where the longer they've been in the country, the less likely they are to kind of fall prey to those traditional stigmas and stereotypes. But it is definitely an issue we see, especially as the immigrant population ages and has more health issues due to this stressful lifestyle. It's been shown that immigrating to the United States at a young age leads to a lot of health issues as they reach about their 60s, 70s, due to the lifestyle that they've led. It's considered one of the most stressful events of a person's life to leave their country of origin and move to a new country. And then after that, necessarily they're not working high-paying, easy jobs like in an office. A lot of them work manual labor, long hours. Maybe they don't get, retirement benefits or free healthcare out of it. And so, they work until an older age of retirement, or sometimes they don't retire at all. And it's a mental burden, psychological burden. So we see that has a noted effect on the overall health of an individual as they age. So not only are we not getting these people in to see doctors or in to have regular checkups or in to maintain their health in general, but they have remarkably worse health. So they're kind of the most vulnerable individuals of this population, and they're receiving the least amount of care. Yes, we've got someone in the waiting room. Let them in. All right. Kind of shifting gears off of that. I've mentioned a little bit the acculturation. There are some downsides to it, of course, like with any, with any like sort of mixed race individual, we see that there's kind of a pool between, one side or the other, trying to find a middle. It's a similar sort of phenomenon with what we call like the first generation individuals. So immigrant parents, but maybe born in the US, or like DACA individuals mainly raised here in the US. We see that first generation Hispanics youth, typically female, but it's pretty high with men as well, have some of the highest rates of depression, anxiety, and suicide. The population with the highest percent of suicide rates is female, Hispanic, or Latina young women. So ages about 14 to 24 has the highest rate of suicide among any other ethnic, age, gender group. So, greater than white male young men, Black male young men, Black female young women, white female young women, even Hispanic young men, even though they are second, the Hispanic young women have the highest rates of suicide, anxiety, and depression than any other group. So that's just first generation Hispanic young women. So it's this world that they live in where they're kind of trapped between, they've got their family at home who maybe is pushing these traditional values on them. They've got their life outside of their home where they're experiencing US culture and US stigmas and all of that. And they're the ones who are aware of, what mental illness is and what sort of treatment there is out there. And they feel the pressure of not seeking out that sort of care, and it ends up having pretty devastating effects on that group. So that's a rather unfortunate side effect of immigration and acculturation. Unfortunately, there just aren't a lot of positive imagery of mental health care in the Hispanic community, and a lot of that is due to, of course, the traditional values, but it's also due to a lack of media geared towards that community specifically. Beth, did you have a question or something?
Yeah, thank you for this. It was being in the schools. That's really not fascinating. I guess that would be the wrong word. That group of young women, it has such a high suicide and depression rate. And you explained why very well. So I guess my question is that something that has to be fixed culturally, because you've talked a lot about the immigrant family and that first generation, or schools or state? What are some solutions to this whole immigrant issue of healthcare? Because it sounds like a lot is cultural. So what are some solutions to that? And maybe you're getting there. I don't mean to jump the gun, but it was like, what can we do?
Great segue, actually.
Can I answer that?
Yeah, go right ahead.
Please, let me add to that. Because maybe you can address this within, Beth had a great question there, so maybe this will address right in. I just wrote this down. There are so many Spanish TV channels, okay? And I know Hispanic families watch TV all day long, okay? And so on. Is there anything that's happening, to Beth's question, on these Spanish television programs to try and get this through to them, that this care is available or whatever else? So maybe you can link those two together. Thank you for letting me interrupt.
Oh, of course, not interrupting. I love questions. It helps me gear where what you guys are interested in hearing. So yeah, you and Beth brought up great points, and I will get to that right now. So you were right. There are lots of Spanish media out there, Spanish radio stations, Spanish magazines, Spanish books, Spanish TV channels, Telemundo, we all know about that. But you're kind of right, hitting the nail on the head in that those aren't necessarily pushing out pro, healthcare propaganda. It's not going to resonate well with the community. And so they're not putting it on the TV. No one's paying to see that. No one wants to see that while they're watching their telenovela at home. So it's not out there in those, sort of mainstream channels. Kind of to answer Beth's question a little bit, media that shows mental health care, just regular health care, exercise, healthy diet in general, is not made for the Hispanic community, period. So, there may be some from small organizations that do a lot of outreach, small mental health facilities in certain states that aren't necessarily government funded, but maybe nonprofit, that try to do Hispanic outreach, but you're not going to see a commercial on your TV that is geared for Hispanic community in general. So that's one of the things that a lot of studies have tried to do. They'll create pamphlets maybe that, are in Spanish, but not just translated from English, created by someone who has that Spanish medical background, but has that Hispanic culture as well. So they're writing in words that aren't scary, that aren't isolating, that aren't clinical. They're writing to people, real people. They're showing real people in commercials, real people in movies that I'm getting a little off track here, but there's this wonderful program that took children with ADHD, autism, Down syndrome, anxiety, took children out of schools, got their parents involved, and formed a study group. And every week they would interview the parents in kind of like a round table, Socratic seminar format, kind of like peer focus groups. And the parents would just talk about what their experiences have been raising a child with mental illness or raising a child with any sort of like mental disability. And they got to see their parents kind of just without any sort of outside influence. And a lot of the parents are saying things like, well, we get the diagnosis and that word in Spanish means crazy. And so I think my child is crazy. And so that's where, I got that bit of information from. But we see the parents say things like that. Then they show these parents videos that show Hispanic children with these mental illnesses or disabilities in a favorable light, receiving healthcare that helps them, it doesn't isolate them, that makes their lives better, that involves the family in supporting these individuals rather than trying to suppress them or trying to force them to be otherwise. So they showing them these videos that were created by the study group, basically like by the researchers, and then they interview them again, and they do this for weeks. They show them a different video, they give them a different book, they give them a different pamphlet, and you can see the parents' opinions about their own children change week to week. And that blew my mind. Maybe it's because I don't have kids. Maybe it's because my family, I'm so blessed to have such a family that, does care about my own health and, does put my health before the, whatever my relatives will think. Maybe that's just me, but it blew my mind to think that like just a video, just a pamphlet can completely change the way a parent sees their own child. And so that sort of thing, clearly isn't being produced enough or isn't being given to the right people enough. Because if they took a handful of people out of a school and showed them a video and that's all it took to drastically improve these children's home lives and drastically improve their relationships with their parents and their relationships with medical professionals, that's not a hard thing to do. It's not that hard to when you test a child for ADHD or for autism, to have someone go in there who speaks Spanish or who is Hispanic or who just has the materials and say, look, this is scary, I understand, but here's some information. I know that English speaking parents get that, white parents get that, but maybe Hispanic parents are getting it and it's just not in Spanish, or it's a pamphlet that's been directly translated word for word from English. or it's an English video that's dubbed with Spanish subtitles. So that's not what they need. It may be, that mindset of separate but equal type of thing. They're getting the same thing in their language, but it's not made for them. And having something made for you makes the world of difference. I mean, who here has had something that was customized and made for them, or maybe a hand knitted sweater versus a sweater bought from the store? And doesn't that make the world of difference? Someone took the time to make it for you. Think about how that would be if someone took the time to care about your child and make this information for you. That way you can better care for your child. Like, doesn't that make the world of difference? So I don't know, does that answer your question, Beth?
Yeah, certainly. And some great ideas there. And it occurs to me that even in teaching, you can try and communicate, and they always, like to parents, they always, oh, yes, yes. And you think, okay, you got that? Did you really get it? And just even knowing how well you're communicating can be a challenge.
Yeah,
Yeah.
exactly. So it's,
You
it's
make a
great
good
that
point. Yes.
when you go, especially here in Arizona, it's great that when you go places, you have English or Spanish option. That's wonderful. That's a great first step. But if you look at them side by side, it's just the English version in Spanish,
Yeah.
which, you wouldn't really, if you put it in a different context, if you just say, I want a different flavor of ice cream. I don't want vanilla ice cream in a different color.
Right.
It's hard to explain. I hope I'm doing a good job, but having the English version just in Spanish typically isn't enough. It's not just American people who speak Spanish. They're people who have a different culture, have a different background, have a different mindset, think differently, and not for any bad reason, but that's just because that's where they come from. Yeah. Does anyone else have any questions about that?
I just wanted to connect that to the concept in computer science of translation versus localization or whatever, for software and stuff. Then a lot of things have been translated, and that's been getting pretty good or whatever. But the thing is, people haven't been doing a good job of localizing things or whatever, or maybe some people have, but there's more work to be done in the field of localization things, definitely.
Yeah, exactly, Maddie. That's a great example.
Yeah.
See,
Hi, this is Terry again. Where do undocumented immigrants go for healthcare?
great question, Terry. A lot of them don't. There's, that's another part of the fear culture is, will this, get me into trouble? And so what we see is a lot of undocumented individuals, if there's not a facility near them that specifically does Hispanic outreach. So if there's not a facility near them that, pretty much only serves a Hispanic community, or, advertises that this is a community they're interested in helping, a lot of them aren't going to seek out any sort of healthcare unless it's a dire emergency. And so that means that if they get an injury, they're waiting until that leg's about to come off before they're coming in to get treatment. They're waiting until the first heart attack before they're coming in to go on medication. We see them waiting until the second stroke, not even the first, second stroke. And so that's another issue where, a lot of Hispanic communities are lower income. So they don't have these outreach centers in them because, they're lower income, there's not the money for it, and it does have a negative impact. Leonard,
I suppose
yes.
that's even true with vaccines.
Mm-hmm.
I have now one of my questions will segue into what you were just saying. Now I don't get around as much as I used to anymore when I was working and traveled more around Phoenix, but there used to be a lot of these herbal Mexican stores around, and using the word loosely, but I think, what is the word for like herbalist in Spanish? Do you know offhand?
Like an herbalist?
Well, they
like
had
like
a
like
sign,
an
and it was obviously
oh, kind of like a
where,
alchemist
you
type.
know, where they sold, you know,
It would translate into English.
yeah, because what
kind
they
of like
did is
alchemist.
they sold natural products.
Yeah, the word in English
Okay,
is more
or
similar to alchemist.
yeah. Well, what I used to see in those stores, and what I knew people that used to go there routinely, is they had all these herbal preparations from Mexico specifically in many cases. They would go in there to get treatment, and they would talk to the person who owned the store, who in many cases was a well-educated herbalist in the sense that they knew exactly what these different concoctions did, like Chinese medicine, except it was stuff that was used in the Hispanic community in the different, you know, from ancient times even. They also used to import drugs directly from Mexico, like antibiotics and so on like that. So I don't know if you're used to that community, if it still even exists, but it did for many years. I've been out here 37 years and I used to see them all over the place. Is that something that they would still go to for medical care as opposed to going into the regular allopathic medical care system in the United States?
Absolutely.
Or if you're not sure, it's okay.
Actually, a great example of kind of that avoidance is they'd be going to sort of home like holistic caregivers rather than the normal Western medicine caregivers. And so these are places where a lot of the times they'll have like a small room in the back where people will give blessings.
I'm losing something here.
Have a blood pressure cuff or something like that. So they'll have a small room in the back where they'll pay a certain amount of money for them to give a blessing or give them a candle to light or give them an incantation to say, something to pray on. That way have that peace of mind about thing. A lot of them truly believe that will serve them, and you know, some of it is self-fulfillment and some of it is just it doesn't work. A lot of those, you know, they will have medicine kind of smuggled over, but that's unregulated. And so, you know, maybe it's antibiotics, but it's unregulated antibiotics. It's not approved by the FDA. You know, there's not really an FDA in Mexico that really regulates things like that, or whatever country they're getting it from may not be, you know, clean, or it's running into these risks of either they're going there more of a spiritual treatment, so that's still not addressing the same issues of like internal medicine, or receiving medication, but it's unregulated. You know, you don't really know what you're getting. You're taking not be, you know, clean. So going, and we've got about left. I'd like to open it up for some more questions. We've already gotten some great feedback, some great questions, but does anyone have anything else they'd like to ask kind of in these last?
Do you know just a little bit more about the healthcare at ASU for undocumented students?
Yes. Oh, great. Thank you for reminding me of that.
Thanks for bringing up that back room thing. I forgot about that because a lot of the times they were spiritual type things.
Yeah. We've already got answering Terry's question. We do see that among kind of college age group, there is.
Can you talk about why it's so hard?
I'm sorry, can you repeat that? Okay, I think there might be a little bit of a lag. So I'll come back to that question, but answering Terry's question now. Yeah, so we do see that among college-age individuals, especially where universities offer, certain free services or certain services for low charge, that they are more likely to seek out, more immediate medical care. So, if you can get a checkup at your local health center for $20 and they don't ask for insurance, or you can sometimes get insurance through the university, that becomes a lot more appealing to young students, especially when they're surrounded by other young people who, do seek out that sort of treatment. So that's a great thing. One thing universities can do is advertise. We see a lot for they're like, come get your flu shot here, come get, an STD checkup, come if you have any sort of like sexual violence or any sort of assault, like come to the health center. That's great if we can see a lot more of that in Spanish, or if we can see it advertised as more of a safe environment. That would be a wonderful thing that universities can do. I know universities are all about making safe environments for these young individuals, not just Hispanic, but all these young individuals who are here to learn and, better their minds, better their lives. So I know that that's already kind of the university goal. It would be great if they could advertise it as a safe environment. That would be wonderful. Let's see, we've got a question. What kind of discussions, if any, are there to tackle the cultural hurdles? That is a great question. There are many discussions. One of the main ones was kind of what I touched on earlier with the bilingual education. There's certain universities in Texas that are forming sort of study groups, but more like peer mentor groups for individuals who are native Spanish speakers who are in social work programs. So there's this one program in Dallas and in Austin that forms these sort of support groups for social workers who come from native Spanish speaking backgrounds. And what they do is they offer them opportunities to do clinical work, field work for their degree in some of these clinics or health facilities that serve the Hispanic population. So they're getting a chance to test out their skills and apply their knowledge in real life situations where you would actually use Spanish and where you would actually need Spanish speaking individuals. And so that's one of the things that we saw had a great impact because they were seeing how their own work was reflected in the community, and they were receiving the support from their peers and from their professors that they needed. It was a very small program, and so they were actually able to, gear lessons more with the mindset of, these individuals think in Spanish, they don't think in English. When they're doing their assignment at home, they're reading in English, they're translating into Spanish in their head, they're writing a response in Spanish in their head, they're translating it back to English. That's twice as much work. So those programs were specifically designed with that in mind, and it had an amazing impact. Their retention rate doubled because of that program. So instead of dropping out, they're finishing, they're getting their degrees, they're getting placements, and now that Hispanic community in Texas has doctors, has social workers, has mental health care professionals that speak Spanish, that are Hispanic, that can provide that level of security and sort of cultural familiarity to the individuals who need it. And so that's one of the things that some universities are starting to take on to kind of tackle those cultural boundaries that are preventing people from seeking out care. Anyone else have any other questions?
Eliana, do you have any specific goals for after college or what you hope to do? Or are you still formulating that?
I have a lot of specific goals, actually. So I myself suffer from chronic illness. So with my degree in genetics, I plan to get my master's degree here at ASU, doing the 4+1 programs, and then move on to get my PhD And my main goal is to do research in chronic illness treatment. So developing treatment for chronic illnesses or even terminal illnesses that is more based on the genetic composition and effects of the illness rather than just the side effects that present themselves or the symptoms, to overall improve the quality of life of those who suffer from it. So for instance, for my illness, all of my symptoms are treated, but none of the actual impacts of the illness are treated. So one of the impacts of my illness is that my skin doesn't produce the protein needed to hold moisture in. So instead of treating that, they give me a lot of like topical steroids to hold moisture in and or repair the damage done to my skin instead of, maybe giving me something to repair, compensate for the protein deficiency. So that's the sort of thing where I hope to work to develop more treatments like that. And then eventually I want to teach at a university.
Very good.
Yeah, great. Anyone else have any questions about me, I guess, or about what I've been talking about? Oh, thank you so much, Maddie. I appreciate that. Ruth, I think I saw you raise your hand. Did you ask your question already?
I don't have any further question.
All
I
right.
just admire your purposefulness.
Yeah, thank you so much. Anyone else?
And there's one thing that you brought up. We were talking about in the culture and TV and stuff like that. In mainstream US TV, you just don't see a whole lot of Hispanics. You've seen more Black inclusion,
Mm-hmm.
but you just, and this is really in the area of drug ads, because
Mhm.
all the drugs that are going to save you and you can live longer with this, and you don't see a whole lot of Hispanic representation.
Mm-hmm.
And maybe it's just me, but I think that
Yeah, you're right. A lot of that is reparation culture. Historically, African American individuals have kind of had it worse than Hispanic individuals just publicly. So a lot of that just comes down to reparation culture, where there is a lot of push to, overcompensate. And so communities that haven't necessarily had it as bad publicly,
Right.
but, very much do suffer in the sidelines, aren't seeing themselves represented. The same thing exists for Asian American cultures or for indigenous cultures. Indigenous cultures certainly have not had it easy and certainly continue to not have it easy, but I cannot think of a single commercial I've ever seen in my short life that targets indigenous cultures. And that's just reparation culture. I saw a hand go up. Beth, did you have another question?
Completely kind of, since you were done, no other questions, more a vocab kind of question.
Yeah.
When I was in Florida, they didn't like the term Hispanic, like there were the Puerto Ricans, the Cubans, they did not like to be Hispanic.
Mm-hmm.
And now we have the whole Latino, Latina,
Mm-hmm.
and now people of color. So I'm just kind of curious, how does Hispanic, what's kind of the difference? What's the proper titles? What do people like? How do we describe that? What's the term to use?
That is a wonderful question. I always say, ask whoever you're talking to. So, if you have a Hispanic or Latino person in your life and you're wondering what the best phrasing is, ask them. More than likely, they're not going to be offended. So just ask them. But historically, Hispanic refers to Spanish speaking. So Hispanic would be, Spain, Mexico, and the other South American countries that speak Spanish. It would not involve Portugal or Brazil because they speak Portuguese. So it would be just Spanish-speaking countries or Spanish-speaking origin, Spanish-speaking individuals. That's Hispanic. It's got the Spain in there. Latino, Latina, or Latinx would be originating from Latin America. So that would be, South America and North America, but not any of the European countries. So if you don't know the cultural background or the ethnic background of the person you're speaking to, you don't necessarily know the specific country that they're from, it's always good to just ask. another resurgence that we've seen lately, starting kind of originating with like Cesar Chavez, is the Chicano phrasing. And that is mainly owned by first generation and beyond Hispanic or Latino individuals. So that doesn't necessarily differentiate too much. It is seen mainly in Mexican American culture, not so much in other nationalities, but a little bit. And that would be specifically first generation and on. So not immigrant, but children of immigrants, grandchildren of immigrants. And so some people do prefer Chicano or Chicana to Hispanic or Latino, but you know, it's never wrong to ask. And as long as it's not done in a, you know, sort of like, who are you, what are you sort of way, as long as it's done respectfully, like with anyone else asking pronouns, and sure, it'll be fine. Two best questions. I'm hearing more differences within the Hispanic Latino person. Yeah, so that is right. Like we don't think alike. Do you find cultural differences? Yes and no. Yeah, I think yes and no is the best way to answer that. There was a lot of material that I read, literature that tried to break it down based on the specific national backgrounds. So, you know, Puerto Rican versus Salvadorian versus Brazilian, Mexican, Guatemalan. And they found that, you know, overall, it wasn't that much of a difference. It was more of a regional difference than it was a national background difference. So it would be more of a difference between Hispanic or Latino individuals in New York than in Arizona, than it would be Mexicans in New York versus Puerto Ricans in Arizona, or, you know, Puerto Ricans and Mexicans in New York. So it's, a lot of the differences are mainly attributed to the regions in the US than they were to the actual ethnic makeup of the Hispanic or Latino populations in those areas. Which is kind of fascinating. You would think that, you know, it may have a bigger issue, and maybe it does in other aspects. But I think the religious aspect is fairly homogenous, and the treatment is fairly homogenous. Most people just kind of assume most Hispanics are of Mexican origin, or treat them the same regardless of where they actually come from. And so I think the treatment being homogenous is pretty responsible for the response being homogenous. But we've got about 2 minutes left. Any last minute questions or comments?
No, thank you.
Eliana, there's Beth. I'm sorry.
No, I was just saying thank you. That was really fascinating. Thank you so much.
This is one of the best forums we've had. Thank you.
Thank you. Yeah, it's very nice to meet all of you guys.
Absolutely.
Thank you guys so much. A great audience, and it's been very nice to see some faces and meet everyone.
Yes.
Very grateful. I had a great time with you guys.
Right.